I'm excited that today is the largest number of attendees that we had thus far. We give yourself a round of applause. So it'll be well over 400 of us today from all different sectors. And that is the beauty about this conference. This is not only just about those that work in the public health domain, but it's about those that have an interest in seeing that their community becomes healthier.
The culture of health is basically, it boils down to this. Everything is health and health is everything. So all of the work that you all are doing, whether your title has health in it or not, or some of you are more public health, some of you are sort of in the communities, all of you are contributing to the health of New Jerseyans, and everything you do is so important to making this a healthier state. In a culture of health, we envision that this is not just about doctors and hospitals. This is about architects talking to teachers, talking to planners, talking to transportation officials, yes, talking to doctors, sort of being in schools.
Population health is about Population Health Village. It is about making sure we all come together from many different walks of life so that we do what we need to do to keep healthy New Jerseyans well, to take those that are at risk and make sure that we educate them, we give them information so that that risk does not come into fruition. And for those that have chronic conditions, giving them the tools that they need so they can manage those conditions, they don't end up with comorbidities, they don't spend their days sitting in a clinician's office, and they don't spend nights running to an emergency department. It is doing what we need to do to keep New Jersey healthy and well. If we want to keep our healthy New Jerseyans well, we've got to create an environment that keeps them well. That means we need to create an environment where you can get and you can have fresh, nutritious foods. We need to create our community gardens. We need to put them in places where they haven't been. We need cities like Camden to actually support community gardens. And we've seen, in Camden, there are over 30 acres of community gardens today. Think about the changes that have happened just there. We've got cities like Newark where you have things, hospitals like Newark, Beth Israel saying, let's take some of our space and turn it into a community garden. Make sure that produce is available for our residents. So it's taking non-traditional partners, taking on non-traditional roles, or supporting the roles that you all have.
Policy matters, and the politics that drive policy matter for public health. What is this? This is the Affordable Care Act. After the Affordable Care Act was implemented, look what happened in terms of the percent of people uninsured by race and ethnicity in this nation. It went down for everybody. It went down for everybody. Everybody. And it especially went down for kids as a result of the Affordable Care Act. And not only that, but we actually saw in our lifetime a disparity closed. The disparity in uninsured rates between black and white kids actually was eliminated as a result of the Affordable Care Act. Who's telling you that? All we're hearing right now is to eliminate the Affordable Care Act. Now, why would you do that when it's actually bringing people life-saving care, closing uninsured rates, and even closing disparities in access to care? What is really driving this agenda? Policy matters, politics matter. Did you know, ladies and gentlemen, that one of the largest anti-poverty programs for kids in the United States of America is, give me the name of it, Social Security. How many of you knew that? Few of you, just a few hands. And traditionally, what we see there in terms of direct benefits, about 3.2 million children receive Social Security directly because either they live with a grandparent, their parent has died, or they live in a family where the primary breadwinner or one of the breadwinners has become disabled. And so you have all of these kids getting benefits through Social Security. But guess what? We have a whole lot more kids, 3.2 million, for a total of 6.4, who are actually getting it indirectly, meaning that they live in a household where somebody in their household is getting Social Security benefits, whether that be an aunt or uncle or whatever. And so Social Security is one of the largest anti-poverty programs for kids. And yet, and you can see here, that more kids would be in poverty without any Social Security benefits, directly or indirectly. That with Social Security benefits, you see that top line, that 40% of African American kids are still in poverty with Social Security benefits. Without Social Security benefits, that would be 58%. For white kids, 21% are in poverty with Social Security. Without Social Security, 39%. Latinos, 28% with Social Security, 45% if they did not have Social Security. And yet one of the things that we are hearing right now, in families with children where someone receives Social Security, it's a big part of their income. We are actually seeing and hearing right now people talking about privatizing Social Security. And guess what? I used to work on the Social Security Committee of the House Ways and Means Committee. I can go toe-to-toe with anybody on the details. I mean, get down and dirty. Any statistic you want to talk about in terms of Social Security, I can tell you because I worked on the committee that actually oversees the Social Security program. They don't have a plan for what happens to kids and families who get left out of that formula. In fact, we will see devastation, economic devastation on a scale that none of our foundations that we're here talking about, none of these privately held foundations, no charities can actually address, like the federal government, if we get rid of Social Security. And children will be devastated.
What I learned at Frost Valley was to cook healthier, and like instead of using olive oil, you could use coconut oil. I remember we made apple turnovers. We used apple slices. We cut them up. We used whole grain wheat flatbread, and we turned it into an apple turnover, and that was really, really good. And then we ate kale chips and I never knew that they existed, and that was really good too. And I was like, hey, what is this made out of? And then my mom was like, oh, it's healthy for you. And I was like, for real?
What do you think we could do as parents to encourage our kids? What did your mom and dad do for you that helped you?
Oh, they just started cooking healthy so I could eat healthy food.
There you go. That's all we gotta do, parents. You gotta get in those kitchens. All right, once again, let's give Joshua a big round of applause for all of his great work and his accomplishments.